Good afternoon. Good afternoon. How wonderful to see so many people, both local hardworking people from Arizona and supporters from across the country, to come in support of the rights of our immigrant brothers and sisters. And here in protest against the policies that are anti-immigrant by the state of Arizona. My name is Dr. Christina Gonzalez. I'm an assistant professor of medicine at the Albert Einstein College of Medicine, and my academic work focuses on health disparities education. I also care for poor, underserved patients in Bronx, New York through Montefiore Medical Center. I really appreciate the opportunity to speak today on our trip to Arizona. How many people do we have here from Arizona? I'd like to thank all of the hardworking people who have been on our conference calls and emailing and providing us with resources. Jason Odner, who's been on many of our phone calls, other local groups, and thank you for the water bottles, and thank you for the great signs and great work. We know that we're coming here for just a few days and showing our support, but we understand that you're working hard every single day, and we want to thank you for that. So who's here from out of town? And who believes in human rights for everyone? You might have heard that other states have thought that some of these policies are good ideas against immigrants. And they might even be policies worthy of being copied in other states. We just want to make it loud and clear that we are people and physicians and other healthcare professionals from other states who think that the policies against immigrants in Arizona are wrong. With that, I would like to introduce our first speaker, or our next speaker, Dr. Mark Ernest. Dr. Ernest is Associate Professor of Medicine at the University of Colorado School of Medicine in Denver, Colorado. He is a great proponent of social justice and physician advocacy. Dr. Ernest?
Thanks, Christina. As Dr. Gonzalez mentioned, I am a physician. And in medicine, we have a principle, a guiding principle that is as old as our profession. And that principle is that first, we must do no harm. No matter how good our intentions and no matter how dire the circumstances we face, it is our obligation first to do no harm. When we as a society determine public policy, our obligation should be no less. As we collectively seek to address the challenges we face, we should heed the words of Hippocrates and be certain that the solutions we employ do not create greater problems than those we seek to address. When we look at the wave of recent anti-immigrant legislation, it's immediately clear that we are harming many. We do harm when we blindly lay the blame for so many of our problems at the feet of the poor and the vulnerable. We do harm when we equate immigrants with criminals, and we do harm when even looking or sounding like an immigrant makes you a suspect. We do harm when we turn medical care and social services into agencies of law enforcement, and we do harm when we erect barriers, real or imagined, between people and the care they need to live and to stay healthy.
Amen.
We can do better, and we must do better. History judges us on how we respond to our sense of crisis. As a nation, we've made mistakes. We've let our sense of crisis cloud our better judgment and shout down our better angels. We were wrong when we locked away Japanese Americans during World War II. We were wrong when we allowed the ownership and the segregation of human beings. And the harm from those choices is still with us today. But this moment belongs to us, and history will decide and judge us for what we choose to do in it. As doctors and nurses, as healthcare providers, we are here today to urge that we first do no harm. Whatever course we choose as a society, we urge that that choice recognize the dignity and the sanctity and the fragility of human life. It is our most basic obligation, and we must meet it in this moment. Thank you.